Something's greater than our hearts. The storms of life will shake our ground. A greater peace still dwells in our hearts. The dreams we build may fall apart. A deeper hope still runs in our hearts. Fear no harm, we are ruled by a far greater love, a far greater Who would have known life would be such a mystery? For the world is yearning still, and our hearts keep burning. We dare to believe there's something greater than our hearts. The storms of life may shake our ground. A greater peace still dwells in our hearts. The dreams we build may fall apart. A deeper hope still runs in our hearts. Fear no harm, we are ruled by a far greater love. We're never alone. All else may go wrong, still will there be a love far greater than our hearts. The dreams we build may fall apart. A deeper hope still runs in our hearts. Fear no harm, we are ruled by a far greater love. We're never alone. All else may go wrong, still will there be a love far greater than our hearts.
Mary, help of Christians, pray for us. In the name of the Father, the Son, the Holy Spirit. Amen. Good morning, educators, guidance counselors, administrators, and to all our attendees. This is Tina de Guzman from Don Bosco Press Inc. Welcome to Salesiana Books Chalk Talk Online. We are now in our second year making Chalk Talk online. But for those who are attending for the first time, Salesiana Books Chalk Talk is a teacher training program that Don Bosco Press provides for its partner schools. Even with the current situation, TBPI continues to aid our beloved clients and create opportunities for training. Thus, we bring you Chalk Talk Online. Today, Chalk Talk Online offers you another series that will help you understand the learners more as we tackle different current issues they undergo and how people around them can handle the situation and support them. The first episode of the Growing Brain Project series, in partnership with the Child Neurology Society Philippines, Inc., is entitled Internet and Gadget Addiction. Internet and gadgets are what our learners most probably have in their hands right now, even as adults. So I know that this is going to be an interesting, productive, and enriching morning. So I will no longer keep you waiting. To formally welcome you and to introduce our speaker, may I call in the Executive Director of Don Bosco Press Inc., Brother Carmelo Martinez, SPB.
Thank you, Ma'am Tina. Good morning to our dear friends and partners of Don Bosco Press Incorporated. Welcome to our first session of this Chalk Talk online series on the Growing Brain Project. This seminar is brought to you by Don Bosco Press in partnership with the Child Neurology Society of the Philippines Incorporated. We are happy to welcome you to this session, which will focus, as Ms. Tina already mentioned, on internet and gadget addiction. Please take note of our schedule for this Chalk Talk online series on the Growing Brain Project. It is set for Saturdays, sorry. It is set for 4 consecutive Saturdays, beginning with this session this morning. And so we hope to see you again next week for the second session. And if you will find this first session, useful and enriching, we encourage you to invite your friends, your colleagues to join us in the succeeding sessions. At the moment, we are around 155 participants, and in the registration, there are around 200 of us who registered. So we hope that our other registrants could still catch up. For now, let's start with a simple poll asking you, how are you this morning? So now I hope it's projected on your screen how you feel right now. Okay, around 35% says that they feel happy. Yeah, it's moving, so let's wait. Okay. Around 35%, around 35% reports that they are happy. Around 30% says that they are excited. There is a small percentage of those who are reporting that they feel anxious. 10% inspired, and around 17% motivated. We also have members of this session who feel sad, and others, and around 4% who have different, perhaps, label for their emotion, for what they feel this morning. So we are happy to be in the company of happy and excited and inspired and motivated participants. We also acknowledge those who feel anxious. And yeah, we also recognize the sadness that some of our participants may be feeling right now, but we hope that through this session, you'll feel much better. Okay, thank you for participating in that first poll. We also would like to know where are our audience this morning are coming from. And so please look at your screen and please identify your location at the moment. So are you from somewhere in the north, regions 1, 2, and CAR? Or are you from region 3? Are you here in the NCR area? Are there people from region 4? Bicol, also in the Visayas region? Okay, we have people from Davao and Soxargen. Wow, a good number. Okay. So we have around 6% of our participants comes from regions 1, 2, and 3. We have around 28% coming from region 3, 27% from NCR. We also have participants from the Southern Tagalog and Mimaropa areas. We have from Northern Mindanao, and we have a big number, 27% comes from Davao region and Soxargen area. Okay, thank you for joining us this morning. I'll now close our second poll. We are certain that this morning session will not only be interesting but enriching as well. We hope that today's input will be beneficial for you and for the many young people you are guiding and helping in their formation. May we also ask you this last poll coming from me this morning. We just would like to see what is your field of expertise. So, what is your professional background? So, here's my last poll for you this morning. Are you from the education? Are you from the medicine and healthcare profession? Do you belong to the administration? Or also are you part of the guidance and counseling program, or are you in the arts? Or if you are not part of any of these mentioned options, please, we would be happy to know your background, where you're coming from, your profession, your field of expertise. You can type it in the chat box. Okay. Thank you so much. I think majority are from the schools, around 82%. We have 9% from the administration. We have 5% coming from the guidance and counseling. And of course, we have 3% from the field of medicine and healthcare professions. And then others, we can check it in the chat box. Thank you so much for participating in our polls this morning. Thank you to all of you, our dear participants, for choosing to spend your time with us this morning. Please feel free to use the chat box for feedback and sharing, and later on, please actively participate in the Q&A portion too. We thank in a special way the Child Neurology Society of the Philippines Incorporated, headed by Dr. Adolfo Solis. You will also meet him later, and his team for sharing with us their expertise and experience, especially in the field of children's well-being and neurologic disorders. We hope that this partnership between DBPI and CNSP will be of help in promoting awareness and adequate information and necessary training on child neurologic disorders. Thank you in advance to our speaker this morning, Dr. Ludelia Calotes Castillo, for your inputs and insights, particularly on gadget and internet addiction. Many thanks goes to our DBPI team too for their reliable and committed service. May I also take this opportunity to invite you to follow and like our Facebook page. You may check out too in our FB page the other online seminars that we are offering during this school break. Muli, maraming salamat po. Daghang salamat, agyamanak. Sabay-sabay po tayong makinig at matuto. Mabuhay po kayong lahat at pagpalain ng poong may kapal. It is also my honor to formally introduce you to our speaker this morning on internet and gadget addiction, Dr. Ludelia V. Calotes Castillo. Dr. Castillo is a child neurologist. She is active in both the academe and clinical practice. She believes in work-life integration and unceasingly learns and relearns the amazing brain from her four little rascals and her extended children, her patients. She completed her pediatric residency and fellow in pediatric neurology at the University of the Philippines, Philippine General Hospital. She took further specialty training in neuromuscular diseases in children at the Royal Children's Hospital, Melbourne, Australia, and completed a summer school of myology in Paris, France. She is currently a clinical associate professor and an attending physician of the Division of Pediatric Neurology, University of the Philippines, Philippine General Hospital. She is also a guest faculty of the Ateneo School of Medicine and Public Health, where she teaches both basic and clinical neurosciences. She has served as a board of trustee of the Child Neurology Society of the Philippines from 2017 to 2018. Dear friends, let us welcome Dr. Ludi Castillo.
Good morning.
Good
Thank
morning,
you,
Doc.
brother, for that very kind introduction. Hi, everybody. Good morning at magandang araw at may buntag sa tanan. Okay, how can I share? Can you share na my slides? So, truly, this is an opportunity for us, child neurologists, to have this platform to reach out to fellow educators like you this morning. Okay, so I'm tasked to give you an overview of of this phenomenon, internet and gaming addiction. So we all know that there's an explosive growth of internet usage, particularly in this unprecedented time. And without that, this is not possible. Chalk talk is not possible. And of course, it has created a lot of advantages. Yet, it it also has a range of side effects, impacting not only psychological health but physical health as well, which is very important for a growing body and a growing brain with a developing mental or cognitive function. So internet addiction or internet and gaming addiction is relatively new psychological phenomenon, and most commonly it's affecting our socially vulnerable groups, and this is the population that we'll be focusing on this morning. So these are my disclosures and disclaimers. Although I'm an advocate for mental health as a child neurologist, I'm not a child psychiatrist or a clinical psychologist or a therapist. But I do not have any relevant conflicts of interest to declare this morning. The recommendations and strategies I will be sharing are applications of what I've learned, not only from reviewing the data, the latest evidence on this subject, but more so for being a mom of four unique and wonderful little rascals, just like what brother mentioned a while ago. So let me clarify what is the role of a pediatric neurologist. You often hear us when somebody has a seizure or an epilepsy, but we are more than that. We do not only recognize and treat childhood diseases of the nervous system, meaning the brain, spinal cord, the nerves, and the muscles, but more importantly, as a child or a pediatric neurologist, we want to ensure that the brain is developing appropriately for age. So we want to prevent these neurological diseases in happening. So this morning, I will try to answer four big key questions. The first one is, how is the developing brain affected by excessive digital media? And in doing so, I will try to give you an overview of the internet and gaming addiction disorder. While doing that, I'll be sharing the red flags of IGD, and at the end, I'll share some strategies that can help us prevent IGD from happening. Okay, as I've said, we begin with taking a bird's eye view of the developing brain and how this is affected by excessive digital media. So I know it can be technical in the next couple of slides, but I promise I'll try to make it easier for everybody. It's a bit very technical looking, but yeah, we are born with a finite number of neurons or nerve cells. But brain development is dynamic, unlike any other organs in our body when we are born. So you can see here, not only is there brain development while we are in the womb of our moms, but even so after birth. Okay. So if you've wondered how many neurons or brain cells inside our brain, did you know trivia about it? You just look at the night sky. Look up at the night sky. They say the number of stars in our galaxy matches the number of neurons at birth. So pantay tayo lahat ng neurons at birth, no? Whether Einstein's brain or my brain, pantay tayo lahat. But this brain architecture is rapidly building connections that in the first few years of life, you can also see the transition, diba, of our baby scrolling to standing and walking to cooing and crying to saying a lot of things, no, in middle childhood. So this pace of rapid development is actually made possible by the rapid neural connections or neuron connections. So these are neurons on your left side. I think you can see my ano. Okay, these are neurons on the left lower corner of the screen, and you see all these branches reaching out to the other neurons. So you actually make 100 new neural connections every second for each neuron when we are stimulated. And this pace of connection has never been matched. Not even the most viral tweet now from the Oscars, no? As far as I remember, before maybe 2 years ago, the most viral tweet I could remember was the one when Ellen DeGeneres, no, snapshot herself with the other Hollywood stars during the Oscars. That was the most viral tweet. But even that, this rapid connection is more than that viral tweet. And that's made possible because of what we call as this synaptogenesis. When all these neurons connect to each other messages, to send messages. And so because of that, a newborn's brain, is just one third of an adult brain. So, but when we get bigger and older, we said kanina, di ba, we have the same set of neurons. But what makes our brain get heavier as we age? What makes it what makes it heavier? It's actually the connections that we make for every second. So these connections can actually result into 0.15 quadrillion connections. I didn't even know that this number existed, quadrillion connections or synapses. So this is what we call as synaptogenesis. So if you picture these wires, these connections, and you lay it down on the, let's say, ground, you would have to go to and from Batanes to Tawi-Tawi 100 times. Ganon ka-amazing yung connection, ganon ka-rapid yung connection at this time. And take note, these connections, the neurons that are making connections every day, is actually experience dependent. So this now this is now our opportunity as parents, as educators, as child caregivers, to nurture a growing child's brain and her or his development. So it's the connections that makes the brain heavier and bigger. So these synapses make each one of us differently wired from each other. So that much. So God's creation in us is really, really amazing. How we put everything efficiently in this hard skull, still a wonder of nature. Okay, so that is an overview of brain development. And if you take a look at this, the development, we zero into the adolescent. How is it different from the younger age group? So in the adolescence, the formation of the pathways in the limbic system. So the limbic system is the one that regulates emotions, and the prefrontal cortex, or the one that is involved for executive function, are of different periods of time. Hindi sila sabay. So the extended prefrontal cortex development is actually the prefrontal cortex development, the one in front of our head in the frontal cortex. That's a bit delayed compared to our limbic. That's more advanced compared to our emotional regulation. What do I mean by that? You've heard our adolescents, right? Our teenagers say they know it's not right, but they could not control themselves from doing it. Prefrontal cortex knows, but limbic system, the regulation of emotions, couldn't handle it because it's not yet mature. So the executive function, the one we're looking at here, the higher cognitive functions are part of executive function. You can still see here that it's still developing within the teenage years. It's a set of mental skills that would include your working memory, your flexible thinking, and your self control. So these are actually like our self-management skills. We use these skills to learn, to work, and manage our daily life. And if we have trouble with these functions, it will be hard to focus, follow directions, and handle emotions, among other things. Okay. So let's look at it visually in terms of pictures of the brain. So this on top, this on the lowermost set of brain pictures is what we call as an eggshell cut. If you look at the brain from the top, okay. So here, this is what we call as a specific technique of the MRI. The white ones reflect the white matter. And when I say connections and synapses a while ago, this would be part or in the white matter. It makes up our white matter. Okay. In the gray matter, you have your neurons, and in the white matter, you all have these connections. So you can see here that at birth, so this is 39 postmenopausal week. So kung term na tayo, di ba, pag mga anak. At birth, the baby has a thin white matter. But as the child grows older, this is 2 years old, you can see that the white matter thickens. It thickens because this is experience dependent. When the child learns a lot of things, then he uses more that connection. That connection creates, gets more bigger, gets thicker as well. Okay. So this is how it looks like. It's actually beautiful, no? If there is actually a human genetic project, there is also a human genome project. There's actually a human connectome project. So these are the white matter tracks in our brain. No? It can be really beautiful. So it's an ongoing project to map the highways in our brain network connections. Another area of interest is whether the development of the processes related to language, meaning grammar, semantics, is by any means affected by extensive screen use in preschoolers. So here, I've shown you the areas, the important areas for language. Speech production, so when we say things, that's the broadcast, and the red one is when we understand or comprehend speech. So that's the Wernicke's area. So here, they're using the same technique I showed you, the FA, the fractional anisotropy. It looks at how dense the white matter tracks or the connections are. So what did they find out in this study? There is a clear connection between intensive early childhood digital media use and poorer microstructural integrity of the white matter tracks between the language areas. Okay, so this screen point, the higher it is, the longer the exposure of the child to digital media use. So here the language is really affected. So language comprehension and capacity are highly correlated with the development of the tracks around this area. So now this study indicates also that reading skills might be compromised if these fiber tracks between language areas are not developed to their extent. In addition, lower executive functions and lower literacy abilities were observed, just like I mentioned a while ago, even when age and average, even when they made everything equal or match by economic status, by age of the child. Also, the digital media use correlated with significantly lower scores in behavioral measures as well. Okay. So therefore, this was actually the pivotal study that made the American Academy of Pediatrics recommend not to use digital media in less than 2 years of age. Later, we'll go back to these recommendations in the latter part of our discussion. So going into the adolescent brain in a simplistic manner, what happens? So the researchers actually attribute the predisposition of adolescents to internet addiction with the lack of effective effortful control. So yung inhibitory control, the high impulsivity of our adolescents, and of course, the highly activated reward circuitry in these age groups. So we'll go back to that in a while. So let's move on to the second part. So knowing the basics of brain development and how this is going to be affected by excessive internet use or gadget use or screen time use. What is now internet gaming disorder or IGD? There's always a lot of controversies, of how to phrase it, how to name it. Sometimes I shift from IA, internet addiction, to IGD, internet gaming disorder, or internet and gaming addiction, because a lot of scholars and researchers couldn't agree agad, no, on what and how to define this condition. Okay, some would say that it has been stated that the addiction framework is a bit restricting, because rather than being just addiction, just like other addictions like substance addiction, there's actually the problematic gaming part may be a result now of a maladaptive coping mechanism and seeking to satisfy previously unmet needs. So therefore, in the recent they separated the gaming disorder. So in the diagnostic and statistical manual, so this is what mental health professionals use, or base the diagnosis of certain psychiatric and developmental disorders in this criteria, or DSM-5. So in the DSM-5, it's a separate entity, predominantly gaming disorder. While the internet addiction, as I've said, it has been named by different researchers as compulsive internet use, or even problematic internet use, or even pathological internet use. In medicine, when we say pathological, that's the opposite for normal or physiologic mechanism in our body. So the American Psychiatric Association recently included internet gaming disorder as a potential diagnosis. So they defined it as a persistent and recurrent use of the internet to engage in games, often with other players, leading to clinically significant impairment or distress. So there is actually a clause, clinically significant impairment or distress. And the diagnosis of internet and video game addiction should include both some screening tools and clinical interview for red flags, such as red flags. I'll be naming. We'll be looking at it in a separate slide. But as a prelude, what are these red flags? If the child is academic decline, previously a overachiever, and then suddenly already failing in his several subjects, for example, sleep deprived child, changes in real life activities and relationships. So yun, naging masungit or very irritable, those are red flags. Indeed, some studies have also revealed that pathologic video game use and high gameplay frequency are functionally distinct. Okay, as I've mentioned, pathologic is already that disease or disorder or a condition, but just saying high gameplay frequency doesn't mean it's a disorder yet, although they are highly correlated. Bago pa maging pathologic video game use, dumadaan siya sa high gameplay frequency. Okay. In particular, when we say internet addiction, this is the most common definition that the recent studies have mentioned. It's actually a non-chemical behavioral addiction which involves human and machine. So it's very straightforward interaction. So going back to, I think I'm gonna go back to the adolescent. So why is then the adolescent brain so predisposed to this kind of behavior? So again, it has been attributed to the still developing higher cortical function, which includes a lack of inhibitory control, and of course, a highly activated reward circuitry, meaning they are very prone to high risk behaviors that would give them uh, uh, instant reward, instant highs. Okay, because they are also impulsive at this time. They're again going back to the executive function, which is not fully developed. So, knowing all this, knowing all this, how frequent is IGD uh, in our in the current setting right now? So, because there's some this for there's no uniform or set uh, criteria yet at present that everybody uses. So there might be some discrepancy in the numbers that you see on the screen, no? Because these studies were done differently from different researchers as well. So here, one study in among Americans from 8 to 18 years of age, they say it's actually 8 to 9 out of 100 gamers met 6 out of 11 criteria, which I will show you a while ago. What are these criteria? Okay. While in Australia, 5% met 4 out of 9 criteria. While in Netherlands, it's about almost the same. A study measuring IGD-like symptoms over a 2-year period among more than 3,000 children in Singapore. So this is an Asian population. Maybe it can also reflect a bit of a bit similar to ours. This is amongst elementary and secondary schools. They say it's roughly 9% of children were classified as suffering from IGD or internet gaming disorder at the beginning of the study. So why am I saying that it's the numbers can be discrepant or very very far. Like, for example, this study said 51 sa Philippines. No, it's really quite high. It's really quite high. So this is a study, an epidemiologic study, recent study. I think this was just in last year. Came in last quarter of last year among 6 Asian countries. And there were about 5,366 adolescents from 12 to 18 years of age from China, Hong Kong, Japan, South Korea, Malaysia, and Philippines. We had about 999 participants who took the Asian Adolescent Risk Behavior Survey. So, so the schools were actually well represented. They got rural and urban areas from each country. In the Philippines, I think they included northern and southern Philippines, Capitolio, Manila, Marikina, Novaliches, and Ubando. I'm not so sure where Ubando is. So the students completed actually a 40-minute structured questionnaire. So ang taas in the Philippines, 51% compared to the ones I showed you a while ago. Well, we could say now it's possible because you can see here that the Philippines remains top in the social media and internet usage worldwide. Do you know that the Filipinos spend an average of 4 hours, sabi ni Rappler, each day on social media, while the global average is actually about 2 hours lang. Global average is 2 hours, no? While this has been our top spot, no, for 6 straight years now, so we have the throne for that. And then to top it off, social media yung but in terms of internet usage, highest pa rin daw tayo, closing to 11 hours per day, and the global average is just 6 hours. So times two yung internet usage natin compared to the global average. Okay, so even though there's a common definition, even though the common definition pala and the diagnostic criteria for internet addiction are continuously under debate, psychologists and psychiatrists have agreed on 4 components essential to the diagnosis. One, of course, there should be excessive internet use, no? Especially characterized by loss of time or neglecting basic functions. So, what do you mean by neglecting basic functions? Alam mo na kung sobra if the kid, smelled already at the end of the day and ate only one meal at the end of the day or quite sleep deprived because these are basic functions. And these are basic functions. So there is always a compulsive striving for internet usage. Kahit kumakain, nag-internet pa rin. And then, of course, there's a growing importance of internet in an adolescent's personal or day-to-day life, no? Na parang, pag walang internet, low ang internet, wala, depressed na siya. Okay, or mabagal yung internet, depressed na siya. The second common component or essential component should be withdrawal symptoms. What does it mean? The adolescent or the person exhibits mood swings from withdrawal symptom. So just like what I mentioned a while ago, when the internet is not available or you have a poor connection at home, for example, the 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 person can be depressed or really angry and anxious, no? Kasi hindi niya ma-update ng social media niya. The third essential component is tolerance. There is a need to spend increasing amounts of time on the internet, exemplified by the need or increased use of the internet to relieve negative emotional symptoms. So, quick fix to make them happy. Fourth, sorry, there's negative consequences. So this is now what the APA or the American Psychiatric Association mentioned. There is already this dysfunction or impairment in the daily lives or function. So because of excessive engagement in internet use, there's a loss of previous, for example, hobbies, social relations, educational, and of course, sport opportunities. No, so they weren't able to do that anymore, and sometimes these people or kids can even go into family quarrels and they even lie with regards to using the internet. Okay, because there is failure of self-control, failure of the inhibitory processes in the prefrontal cortex. But internet addiction is just a tip of the iceberg. Numerous studies have convincingly demonstrated that internet addiction is actually a comorbidity with a range of psychopathologic conditions. And the common themes are depression, underlying attention deficit hyperactivity disorder, more than anxiety, more than anxiety. So again, IGD or internet gaming disorder may be influenced by other mental health issues. And this could just be a maladaptive strategy to cope with the psychiatric underlying disorder like the depression or ADHD. That's why some of the mental health professionals wasn't they didn't accept agad as a separate disorder because some actually push that it's actually a maladaptive coping strategy rather than a separate disorder. So let's move on to red flags of internet gaming disorder. And when we talk about red flags, I'll be already as well presenting the criteria under the DSM-5 for diagnosing IGD that our mental health professionals use. Okay, so it's actually 5 or more of the 9 criteria within a 12-month period. One, there's preoccupation with games. Of course, the individual thinks about previous gaming activity or anticipates playing the next game. So, gaming actually is now the most important thing in his life, the dominant activity in his daily life, not school, not family. Second, just like the for essential, the withdrawal symptoms. So again, when the game is taken away, these symptoms are typically described as irritable, naging anxious, naging depressed. Tolerance, already mentioned, the need to spend increasing amounts of time engaged in games. And four, there is actually unsuccessful attempt to control or reduce participation in games. So they've tried but couldn't. Okay. And five, just like the part of the four essential components, would be the loss of interest in real life relationships, previous hobbies if you play soccer before, other entertainment as a result of, let's say, he used to, let's say, cook or dance, so hindi na nagagawa yun because it has been replaced by this internet addiction or gaming addiction. The sixth criterion would be a continued excessive use of games despite the knowledge, despite being called out that there is already a concern or a psychosocial problem. Seventh, has deceived family members, therapists, even, or others, or even you as educators regarding the amount of gaming. So when you do check in with your students, they would say, "Oh, I study, miss, but no, they didn't improve their grades." And then they say, "No, I just did 2 hours of gaming." So when they start to deceive us, parents and educators as well, then that is already a problem. Uh, uh, Eight, the use of games to escape or relieve a negative mood. So when there is feelings of guilt, anxiety, or helplessness, especially in this time of pandemic when a lot of kids and teenagers are thrown into anxiety and depression, then it becomes their escape mechanism. Last criterion, has jeopardized or lost a significant relationship, job, or a scholarship, or an educational or a career opportunity for adults. Okay, for adults, a career opportunity. Na fires at work kasi weren't able to finish our responsibilities. So the DSM-5 suggests that IGD may be identified again by all of these five or more criteria, using those. But there are a lot of things that, in terms of looking at who are more at risk, really, in terms of uh, developing the symptoms of addiction. Will it be the more impulsive kid? Will it be the family or the children who comes from lower social competence, or kids who really play the longest in terms of gaming, or kids or families who come from a home with negative parental attitudes toward gaming? Parang tayo to, di ba? In the Philippines, almost all parents would say that no, gaming is bad. Okay, except for a few. No, when they're able to play with their children, and that's actually good. No, knowing what your child plays would be, uh, I think, a better way of understanding them as well. Lower family functioning, are these the kind of kids or adolescents who will develop more of the symptoms of IGT? Or is it because they have adaptive problems? So what are these adaptive problems? Adaptive problems, a study in China, no, they say that it's actually a major predictor of internet addiction. So among Chinese college students, they've seen that Chinese college students who are internet addicts are more likely to have eating disorder. So it's more of their adaptive way of going about their eating disorder. So, and Chinese adolescents who are internet addicts have a greater likelihood of suffering also from depression and anxiety as a comorbidity. Okay, so a lot of things still we're not yet too sure which adolescents or kids are really at the most risk for developing these. But of course, smaller studies have already shown some trends, like for example, as an adaptive problem. But those who had increased gaming symptoms, it would show evidence that there's actually a greater level of depression, academic decline, and even worsened relationships with parents over time, because of course, no, that's always gonna be like your argument and quarrel and a challenge, no, in every day if you see your child being locked up inside your room, inside his or her room. And with that, there is also increased aggressive tendencies. But really, little is still known about how long it takes to develop, how long it will last, or whether it is continuous or intermittent. Okay, so there's still a lot of questions as to uh, how long will it last. Will Can you diagnose it if it's just happening in this quarter, but then when summer is out, they're not exhibiting, they're not demonstrating it, then it comes back again. So that's like intermittent. Okay. So, as a side note, though, there's actually a profound effect on the human behavior in terms of aggressive behavior. So, they've seen that in review of a lot of data, exposure to violent games is a highly significant risk factor for increased aggressive behavior, and as well as a decrease in empathy and lower levels of pro-social behavior. And of course, we all know that this affects their sleep deprivation. And coming from a point of view of a pediatrician, uh, when we are sleep deprived, not only the kids, no, when we are sleep deprived, our metabolic pathways go also crazy. So you can see that sleep deprived individuals are also heavy. Now, when I went to med school and had a lot of duties in the clinics, I really gained a lot of weight because we were so sleep deprived. We don't sleep for 24 to even 1.5 day. So our metabolic metabolism also goes haywire. So there's also, of course, increase in stress levels, and if you have increase in stress levels, uh, then physiologically the body can easily get sick, and then our immune system can also get affected as well. So these are only a few of the reasons why the American Academy of Pediatrics recommended the limit in terms of screen time. Okay? Screen time. So I've mentioned this. There are a lot of things still in IGD that we don't know that much yet. Like what are the risk factors for the development? Um, what is the clinical course? How long will it last or develop? And more importantly, what is the most effective treatment? So there is still no collective effort to look at in terms of in medicine, kasi we look at randomized and controlled and large studies before we really say that this has level A evidence in terms of recommendation for treatment or therapy. So here, the trials need to be applied to well validated outcome measures, no, to also include long term assessment. And then, of course, there's also this, it's likely that not every type of video game is equally associated with IGD. So we need to still characterize or outline the games that are more or less associated with the addiction or the disorder, as well as to determine also in terms of the direction of the influence. Now, let's move on to the last part. How do we prevent this condition? So the American Academy of Pediatrics, they recommend that parents need to be directly involved with their child's use of media. And we need to ensure that children have ample media-free time and access to non-gaming creative play opportunities. So here I provided this picture because we all know that educators are also the second parents of our children, no, in the school setting and even in the virtual school setting. And likewise, in that essence, you're also a primary care provider. You're also a first uh, responders as well. So in that case, you this also applies, no, yeah, in terms of media use, no, particularly in our setting, in a virtual platform setting or virtual learning setting. So we start them right. We start them right. Okay. Based on the study I showed you a while ago, media use should be very limited and only when an adult is standing by to co-view, to talk, to teach and explain what the child sees on the screen. But this is so contrary to what we see, no, left and right in the Philippines. Because what happens? Maybe it's not just in the Philippines, no. The gadget becomes a digital nanny. The gadget becomes a digital nanny. Bakit naman, di ba? Dati, yung mga lola natin, they survive with a lot of anak, children, without a digital nanny. Okay? For example, the only time that we can recommend, the American Academy of Pediatrics can recommend digital use in this age group, younger than 2, is when you video chat with family. Particularly now, we're all still in a community quarantine. Okay, so we start them right before they get pathologic behavior around internet use. What about when they are a bit older? Maybe 18 to 24 months. So there's a specific recommendation for this age group. So if you really want to introduce digital media, the recommendation is to choose a high quality programming. It's just like what you use probably for primary educators, right? um, when you use some educational programs as well, right? Because it's a virtual platform, so we don't have a choice. So just like that, so that could be considered high quality programming. Of course, the use of media again together with your child, and again to avoid solo media use. Okay, avoid solo media use. Not, you can't just leave your gadget to your child, to your toddler. As you all know, the screen is already very intuitive, no? And our digital native children can easily understand and know what to do next, no? Because of the overstimulating figures and pictures and diagrams on the screen. As the child matures, media use should be regulated in a way that teaches the child when and how to stop. Such as, for example, uh, at home, I agree with, we discuss with my kids that you can only open your media after you eat, you brush your teeth, and you take a bath. Okay, so it's a no-brainer. So they can have it until we see that they've done it. Okay, so and then you set a duration. Okay, uh, before, let's say for example, before starting to play, and provide for the smaller ones a visible timer, or an alarm. Okay, if this alarm sets off, then give it to mom. Okay, so we have to monitor the use. And of course, we go back again to choosing the media that is interactive, non-violent, educational, and of course pro-social. Mahirap na pag YouTube lang, 'di ba? Kasi they can click anything that's popping up on the side. And then going back to the first principle, always co-view, co-play for this age. So it's gonna be difficult because everybody, well, a lot of us will be working from home. So that can be really tricky, really tricky. What about older children, for grade schoolers and teens? Ito mas tricky. Since we know that teens, uh, dictating to teens will not work. For sure, we know that because they already have higher cortical function. Remember, they will just shut us off. No, it's like my teenager; he will just shut me off. So we cannot impose on them. But as again, as a child matures, it should be regulated in a way that teaches them how to stop. Okay, so don't let media displace the other important activities. So you set the rule because we are the parents, we are the more mature individuals at home. Then we we give them that the choice that if you show me that you are responsible enough to control your use, then I will let you do it. If I see that you're not responsible yet, then mom will set the boundaries, will set the duration. Okay? So, and it shouldn't again take away the time for the basic needs, for quality sleep, for regular exercise, for of course family meals, and of course unplugged downtime. Should have some nap, for example, particularly after asynchronous class. Um, one thing for sure though, when for example, when your teenager or our students will say, "Miss, I still fulfilled my 8 hour sleep a day, but she started sleeping, for example, at 4 a.m. until 4 p.m." Okay, sleep debt, meaning utang sa pagtulog, cannot be paid off by daytime sleep. Why? God made nighttime dark and daytime bright because it's a cue to our body clock that's in our brain that is being perceived by our eyes. Okay? Kaya nga mahirap matulog, 'di ba? Pag bright. Okay? So our body clock can really get crazy if that's the case. Okay? Again, agree to set a duration. Okay? In all ages or for all age group, everybody, all adult, parents, educators should be a media mentor. You should be a media mentor. So we same rule, co-view with your kids. And then of course, if you don't want it to disrupt their sleep, do not put media in bedroom. Meaning TV, a big screen should be a no-no in in your bedroom or in your child's room. Okay, in your child's room. Yun nga lang, a lot of us are would have like a small space no at home. Then that would be really also difficult or tricky. And then again, as I've said, if the kids couldn't demonstrate responsibility and discipline, then the parent should set the rules. Let them know again how when at what up to what time. Then then we teach them how to self-regulate their own behaviors as well. So what about oh one more thing. So when we say sleep hygiene, it's also important to really have a routine rather than just the duration. Okay, so with video or screen time should be at least half an hour to an hour before your sleep time. That is related to how our brain perceives nighttime as dark and daytime as bright. Okay, of course, if you always look at a bright screen, then that would really make again our body clock confused. Okay, there are also recommendations for educators. Um, Schools at all levels should routinely include education about internet gadget disorder. So this is actually now a challenge for us educators, no? And expand the infrastructure, our virtual space, our let's say classrooms, no, for other potentially problematic behaviors as well, no, to include these problems with electronic media. Okay, because there's always a consistent link, between IGD and other poor school performance, just like I showed you a while ago. And this may be an excellent place. No, school may be an excellent place for screening for IGD, particularly when your child checks in with the guidance counselor or with a homeroom teacher, and you see a sudden change in the behavior, in the academic performance, then treat it as a red flag, and probe more into the history of the child and the child's activities as well. And with that, if at school you'll be able to screen for this disorder, then uh, proactively we can start providing referrals for services when we see a problem or there is some related issues uncovered. Many schools though also provide computers, diba? Or let's say gadgets, as this can have tremendous benefit, of course. But other schools also have gamified their educational processes. No, so it might be something that we should actually think about. No, if that is something that will be a potential for the development of IGB. I'm not so sure. No, I'm not so sure to the answer to that, but it's a challenge or a question raised, no, by a lot of researchers on this. Schools should also provide training to parents and educators to recognize potential problems, because more often than not, you'd always be the first, the first uh, caregivers or providers who will see the family first before any major problem happens, before they actually consult if their physician or their pediatricians. Schools and community centers can be also of particular value in helping parents to identify non-gaming creative opportunities as well. Okay, so of course, if we don't provide our children, our students with other options of activities, then really the internet would be their escape route. The internet would be their default. Okay. For example, recently I needed to find not nature exposure to my kids. So we went to a farm just so we can have an offline weekend and to break that cycle of doing screen time every day because of school, because of course, homeworks and non-academic activities as well. Okay, so we really need to find ways, no, give responsibilities, no, to your children at home. My 4-year-old can sweep the floor. Or, if the yaya is not there, nawalan tayo ng yaya, then that's a blessing in disguise. Because that will be an opportunity for our children to do household chores, to be a responsible child. And that can build self esteem and responsibility as well. So, yes, there's really a need for us to be creative because right now what happens is the internet is their default. So I'll end with this take home message. One, that the developing brain is vulnerable to excessive digital media use. Um, Two, that there is already con- disorder that manifests with internet and gaming addiction. And that excessive internet use, the tolerance, withdrawal, and negative consequences are essentials in the diagnosis of this disorder. And lastly, what would be the best strategy in treating or managing internet and gadget disorder? We start right with a healthy digital media use because technology is already here. We can't say no to it because we need it. We just need to give handles to our children, to our family, in terms of doing it right the first time. So thank you for your attention. For any questions, if you're shy, you can email me or message me through these channels. And good morning.
Thank you so much, Doc Ludi, for that insightful discussion. Before we go on to our Q&A portion, at this point, may we invite Dr. Adolfo D. Solis, President of the Child Neurology Society of the Philippines Incorporated, to talk about CNSP.
Thank you. Good morning, everybody. So, I would like to introduce the society to you as well as our flagship project, the Growing Brain Project. So, our society, the Child Neurology Society Philippines, is actually the only duly recognized and SEC registered organization which is locally and internationally recognized, which is based here in the Philippines, a group of child neurologists advocating for child neurological health. And our flagship, uh, official flagship advocacy outreach program is what we call the Growing Brain Project. So the Growing Brain Project was launched in 2018 during the incumbency of our president at the time, Dr. Jean Marie Ahoro. And the general objective of this particular Growing Brain Project is to instill awareness, adequate and proper information, and advocacy training on childhood neurologic disorders to stakeholders such as the health institutions, professionals, health advocates, and families throughout the country at the community level through the utilization of various communication and evaluation tools. Specifically, we would want to evaluate particular communities as to its needs as far as childhood neurological health and conditions are concerned. We would also like, through this advocacy program, we would also like to conduct learning and advocacy activities concerning childhood neurologic conditions in various places in the Philippines at the community level and to address the particular concerns or issues of particular communities regarding childhood neurologic conditions. We would also like to network with various government institutions or advocacy groups to further propagate the advocacy of protecting the developing brain, prevention strategies to help eradicate the unhealthy consequences of the developing brain, and to promote healthy approaches to optimize the potentials of the developing brain. And this is what we call the three Ps. Next is we want to engage the health professionals in capacity building on the knowledge of childhood neurologic disorders, focusing not only on approach to diagnosis and current treatment protocols, but also on the natural course of the disease, pathophysiology, and on educating parents and their families. And finally, we would also, through this advocacy project, conduct research in order to further improve the care for children with neurologic disorder. So we have divided the Growing Brain Project into three phases. So the first phase is for the physicians all over the country. The second phase is for allied medical professionals and educators. And the phase three would be for the community level, which will involve the barangay health workers, families, policymakers, and health institutions. So as you can see, we are now on phase two of this Growing Brain Project. Just to give you a brief overview of what we have already done since 2018, in 2018, we started conceptualizing the Growing Brain Project, but it was in 2019 when we actually first rolled out this particular project, starting off with my hometown in Dagupan City. And then we followed it with another run. This is phase one in Nueva Ecija, Cabanatuan City, and then followed by another run in Calamba, Laguna. And then the fourth run was in Tarlac. And then the fifth run is actually in Zamboanga. Uh, Let us pause for a while. My slides are, yeah. So the fifth run was actually done in Zamboanga. So as you can see, we have already gone extensively all over the country in rolling out the phase one of the project. And then we proceeded with the phase two early in the early part of 2020 at Don Bosco Technical College in Canlubang, Laguna, where we had more than 500 attendees. Unfortunately, after this event, the pandemic struck, so we had to pause for a while. And these were the topics that we rolled out during the phase two in Canlubang. So we had topics on developmental disorders, epilepsy, mood and anxiety, and substance, internet, and sex addiction. So before I move on, I would like to entice all our online participants that in the future, if we would have more series of the Growing Brain Project, I would like to entice everyone to please type on the chat box or email us or contact us through Facebook which topics you would like for us to discuss with you. So, because we had to pause for a while because of the pandemic and we had to ponder how we are going to continue with the Growing Brain Project, at the later part of 2020, we decided to go on with the phase one of the Growing Brain Project, but this time through a virtual run. So, we completed our virtual run in the regions of Mimaropa and Bohol, as well as Cordillera, Region 2 and Region 5. So our plan for our society is to complete phase one in Visayas and Mindanao until the end of this year, and also to continue phase two nationwide still, and hopefully to continue or to start phase three in 2022 in a limited capacity if the pandemic would still go on, and of course to optimize the use of multimedia to further promote the Growing Brain Project. So I hope you would be able to patronize our project. And I would like to thank again the Don Bosco Press for allowing us to collaborate with them with regard to this very worthwhile project. In particular to Brother Carmelo Martinez for his wholehearted support in this particular project. And I hope we would have more collaborations in the future. Thank you so much.
Thank you, Dr. Solis. TBPI is really grateful to CNSP for sharing the Growing Brain project to us and to our partner schools through Chalk Talk Online. So may I just repeat the request of Doc Solis that if you have suggestions for other related topics that you want to have for future seminars or series, you may just type it in the chat box or you may email them to CNSP. All right. So right now we should have a 5-minute health break before we go on with the question and answer portion. But you may start typing your questions through the Q&A part of our screen. So there are already questions coming in, but after the 5-minute break, we shall start with the Q&A portion. Thank you.
We shall now pause for a 5
We shall
minute
now
health
pause
break.
for a
Thank
5 break. Thank you.
Welcome back, everyone. So it's time for us to answer some questions. Today's topic is really interesting, not only to educators, to counselors, but as parents, for those who are attending as parents, there are really interesting questions. So let's start. So this question has two votes. So is there a program that associates gaming to online learning?
Okay. By program, ano kaya ibig sabihin nun? Study or data? Okay. So as I mentioned in my, I think, previous slide, latter part of this discussion pala. So there are still a lot of things that we don't know about internet addiction and gaming disorder. One, if is there a characteristic to the gaming that would, push a child to more of an addiction? Or is there other games that are also useful in terms of learning, particularly now, as we're in a virtual setting? So a lot of our materials are really online, no? Well, for some na modular, they can still print it out, but yeah, um, that's actually something that we look forward to, looking at the data in the researchers that will be published in the next couple of months. But as far as I know, uh, in terms of gaming and online learning, there are already a lot of learning styles that already incorporates gaming into learning, but not the kind of gaming that is addictive. It's really more for special needs children. For example, for Down syndrome, so they need a particular sensory processes, no, to be able for these children, no, to process it in a unique way that will address their needs. So I hope that somehow gives you an overview of it.
Mhm. All right, thank you, Clarice Sermilias, for that question. So let's move on to the next question from uh, Josela Tejada. So my girl will be turning 3. I can't understand some of her words. What am I going to do? Is this normal? I think there is a follow up from her as well. She's not fluent compared to other toddlers with same age as her.
Okay. Okay, so these are really very valid concerns because as parents, we know that there is really something off, no, about that. And I've shown you already that the language centers are really quite sensitive to excessive screen time and digital use. No, so excessive screen time is not only for phones and even for TV programming. No, TV programming kasi dati sa atin yung TV natin hindi naman excessive eh kasi may time si That's Entertainment, may time si Regal Shocker, 'di ba? Hindi naman like unlike Netflix na you can just turn it on any time of the day. So it's different, no? So screen time now also includes TV time because our TV now becomes the screen for our internet as well, diba? So to answer your question to that, you really need to go back. You really need to have this discussion with your pediatrician, and then from there you get the proper evaluation and assessment. But definitely for a 3-year-old there's something off in that because a 2-year-old can already speak 2-word phrases. A 3-year-old would speak 3-word phrases clearly, so they would be somehow 80 to 90% intelligible, meaning you can somehow understand already their words, di ba? As parent. Yung iba pwedeng hindi makakaintindi. Pero dapat mauna tayo nakakaintindi ng mga
Yeah.
gibberish na sinasabi ng mga anak natin, right?
Yes, I agree with that, ma'am. Okay, so we hope that you get your answer to the question, Miss Josela. So let's move to the next question from Miss Maria Corazon. Can there be a possible way to wait? Can there be a possible way to stop or lessen a child's addiction to online gaming, observing that they kept awake at night, playing and sleeping the whole day? Thank you.
Thank you. I really like that question because I've also been asking that question to myself. No, every time I see my kids, sa either four, no, every time I see my kids, parang napapaning ako, parang too much na ata yan. Kanina pa sila, no, parang so because we are working from home, no, most of us are working from home, we really do have a tendency talaga na ba to parang look at them from time to time and then maano ka na, too much na kaya. But you know when it's too much, when it interrupts their sleep. Okay? When they can't do the basic needs, no, for their body. So what do I do? Even for my 4-year-old, I explain it to him in a way that he will understand. Okay? So one, for a 4-year-old, what would be a catch for a 4-year-old? Being cranky, being not able to run around because he's sleepy, he's he can't play well because natutulog lang siya the whole day, if he sleeps late. Or the catch for my teenager, you know what? Nighttime sleep is really associated with growth hormone spurt. All teenagers want to be tall. Okay?
Mm.
All teenagers want to be tall. And you have to tell them that sleep depth will not compensate for the growth hormone spurt. So, hindi totoo yung sinasabi ng nanay ko na, matulog ka ng hapon para tumangkad ka. Hindi na ako tumangkad. Hindi na ako tumangkad sobra, di ba? Hanggang 5 lang ako. So, it's really the nighttime sleep. And of course, genetics will also, play a big role on your height as well. But know your child. And then yon, para it should be age appropriate discussion and negotiation. As I've said kanina, pag teenager, you can't impose a rule. You have to make them understand because their higher cortical function is already kicking in. It's more of their emotional regulation that is delayed in action. So they couldn't inhibit themselves. They couldn't control themselves, even if they know it's not right. Therefore, you tell them, trust me, your parent, not trust me, your nanay, for example, because as of now, we know what's best for you, and we can help you control yourself. We can help you regulate yourself. Okay.
Okay, so thank you, Doc, for that. So let's move on to the question that got 4 votes from Miss Sheila Maris. May I ask, what age does a child should speak clearly? Yung hindi na po nauutal or nabubulol?
Okay. So it should be 2 to 3. 2 to 3. Yeah, 2 to 3. What happens kasi, our kids nowadays are really digital natives, di ba? As I've said, na-amaze yung mga lola kasi nabubuksan nila yung phone. Nakaka-navigate sila sa YouTube. Na-amaze si lola. Pero it's just a default for these kids or toddlers, no? Digital natives sila eh. And with that, there's harm in that, as I've shown you. Why? Because their brain will think that there is no need to talk anymore because the phone, the gadget is doing it for them. Because the phone is thinking for them. Because the phone is drawing the picture for them. Compared to reading a book, for example. When you read a book to your child, read out loud, side by side, the child will get more connections in her brain. She will imagine those words. She will paint the picture in her head. Okay? Compared to a child who sees it passively, who hears it passively from a non talking, non communicating, in an interactive way gadget. Okay? These connections are very thin and it won't last long. And it won't make this language development really possible. That's why you see a lot of kids really still not intelligible. No, they go past 4 years old. No, but once you really impose this healthy gadget use and make time to read to your child, to talk to them, those language skills will kick in. Okay, they say the kid before 5 years of age should be able to hear 30,000 words a day. Ganun kadami. And how do
Mhm.
you, to be able for a normal, language development to occur, how do you do that? You do that by reading a book. When you read the book, you tell stories. You ask them, di ba? How do you feel about this? What does it remind you of? Or paliguan mo siya, kausapin mo siya, right?
Mm.
Yung pagligo mo, hindi routine, but already teaching him what his body parts are. Okay? So those are all opportunities, particularly now that we are all, most of us though, are always at home. Okay.
All right, thank you, Doc. Now, let's have the question from Hexel Andrew. My 2 years old nephew watched Coco Melon at least 3 hours a day. We observed that he was able to learn fast and mimic some motor activities. However, some studies said that watching Coco Melon is not good for toddlers. What can you say about this?
Okay. 2-year-old na siya. So actually, hindi naman siya no-no not to, watch again video or a programming. No? It has to be high yield programming and co-viewing. Okay. What happens is that we always hear that from family na nakasalita naman siya. But take note though, really listen to the quality of their words and phrases. Okay. Some kids might not be really conversational, but really throws off phrases only. Okay? Kasi sabi mo mimic. The word is mimic. So, it might just be Some, I'm not saying everybody, no, some who are very vulnerable might just be parroting what they hear from the media. Okay, but when you ask, when you make a dialogue with them, there's actually a problem, no, in uh, to and fro in the communication or in the interaction. Okay, as I've said, the connections are much longer, wider, more if there is really co-viewing, somebody's talking with them while watching it, making them understand it more, making it relate to day-to-day lives. Okay? Kukumalan is okay. Nanonood nga din yung anak ko niyan eh. I'm also guilty sometimes, no? If, wala na ibang titingin. I'm also guilty. No? I'm not saying that that's totally wrong. It has to be balanced. Okay? It has to be balanced. Okay?
All right.
If I can't co-view, then my older kids will co-view with him. Okay? So use your older kids. Okay? Use the other members of your family. Okay?
So having a co-viewer with the child is really important. So that's
Yes.
one of the
Yes.
Okay, thank you, Doc. So for the next question from Miss Maya Grace, during the face-to-face classes, we discourage students to use their gadgets. However, when pandemic hits the country, we encourage them to be attentive to their gadget since classroom instructions were being mobilized through gadgets.
True.
So as such, students are not being attentive to it. Thus, how to make students be motivated to use gadgets as means of learning?
That's really very tricky to actually answer, no? Bakit? Because particularly, no, in our teens, pre-teens, let's say teens, pre-teens, no, when they really can't organize themselves, the structure of their day, the schedule of their day, diba? And then they can easily get distracted with a lot of things in their gadget, from social media to chat box to a lot of IMs or instant messaging. So how do we do it? You really have to work hand in hand with the teacher and the parents. It has to be that has to be, I think, the best way. When the pandemic, when this started last year, no, I trusted my eldest child because I know his learning style. I trusted him. I said, kaya mo na yan, mag-isa ka na. Sana, iniwan ko lang kasi may trabaho din kami, no? Lahat-lahat, kanya-kanyang sulok ng bahay. Okay? And then, and then I saw already some red flags. Okay? And I realized that I had so much expectation for my growing child, no, that is beyond his age. I should have known better. Okay, so as parents, we really need to scaffold them. We really need to really look at their routine. Like they should stick to their routine for them to be able to follow through your lessons, your the deliverables, the deadlines. Okay, so that was actually misgiving from my part, no, as a parent, and because I overestimated my child. Okay, so much stimulation and temptation in the internet. You really have to give specific structure and handles.
Okay, thank you, ma'am. So next question from Charles UC. Should parents support their teens who wants to become a professional gamer?
Yeah, yun yung mahirap kasi cultural, 'di ba? Cultural tayo, yung sinabi ko kanina, that parang ang Filipinos may negative attitude towards online gaming, 'di ba? Parang 'pag nakakita mo diyan na nagge-gaming 'yan, nakaano siya sa cafe, bad 'yan, bad. Pero sometimes some go to the cafe because they don't have a computer at home and they make their, they make their assignment there. So there is actually a stigma. But of course, we don't, hindi naman tayo susunod sa sa stereotype. If that is aligned with the values of your family, if that is aligned with your child's passion or his future plans for himself. Why not? 'Di ba? We always parang tell ourselves na okay, we give them the opportunity to find where what they want to be, who they want to be, 'di ba? We just provide them the opportunity, but we can't dictate, and they just have to choose it for themselves, 'di ba? They may want it now, pero baka later they will change their mind. So make creative opportunities, non-gaming creative opportunities for your child, and give him more options if you feel like strongly about it. But of course, at the end of the day, it has to be a dialogue.
Okay. So next from Miss Rosalia, is seizure a cause of too much exposure to gadget?
Um, yes and no. Yes, for a small population of patients with epilepsy, but not the gadget part. Okay. Seizure per se is actually electrical short circuit, no, in these connections in the messaging in our brain. Uh, but only a small part of patients or child or individual who has a predisposition to seizure. Meaning kahit walang lagnat, walang infection, may seizure sila. So ang tawag nun, epilepsy na. May certain kind of epilepsy which is actually photosensitive. Therefore, if there's flashes of light that comes off in a game, like in one Pokemon episode, maybe in the 1980s, no? Merong madaming nag-seizure sa Japan, no? During that time, and they call it Pokemon seizures, I think, or something like that. No, I can't remember the exact details, no? But that was actually because of the photosensitive aspect of certain kind of seizure, but not the gadget itself. Okay? One caveat though, doon sa mga merong epileptic disorder or may epilepsy or may seizures, exposure to prolonged gadget use can make them fatigue, can push them to sleep deprivation, can make them miss their medication or their meals, which are actually the triggers for seizures in those population, in those kids na may epilepsy, but not for the usual population na wala. Is it clear?
Yes po. We are learning so much today. Thank you so much, Doc Cludy. So let's have the next question. Thank you so much, Doc Castillo. I have learned a lot. Such addiction is perceived to be a prevalent problem, especially that the learner's cyber exposure is difficult to control. I would like to conduct a research on this in our school,
Good.
Mariano Marcos State University Laboratory Schools in Lawag City. I hope you can help me even for some need assessment data gathering materials, only if it is possible.
Sure, we would love to collaborate with you, ma'am. That would be a very nice opportunity, and that is also one thing that we want to come to hear from this talk, no, like what Dr. Solis mentioned kanina, diba? That one of the goals of the Growing Brain project is really to start off research and have our own data, not just like one of the studies that I've showed you a while ago, but that was actually a collaborative study with other countries. That would be an amazing study.
You may just reach out to CNSP or through Doc Ludi yourself. Okay. Next question from Miss Imelda. What is the ideal or maximum number of hours for online classes?
Online classes. Very good question. It has to be developmentally appropriate. It has to be developmentally appropriate. Like, for example, your toddler can only do 30 minutes on a sitting, okay? Sitting. So, then depende kung anong age group yon. Of course, pag older age group, then you can even chop it off into 30-40 minute block, di ba, per subjects. Because of the attention span, you have to take into consideration the attention span and of course the developmental age of the child.
Okay po. So, next question from Glee Alfajardo. Aside from online gaming addiction, is watching anime series or other forms of film more detrimental?
Sorry. Aside from anime
Watching
series,
anime series or other forms of film can be more detrimental.
okay, okay. Okay, I see where you're coming from, ma'am. Okay, now it would be detrimental for a toddler. Okay, so you have to follow. Ang problem lang kasi sa mga Netflix ngayon, although may nakalagay pala na ano, no, age appropriate, so you have to follow that. You have to follow that. Kasi di ba, like for example, ano ba yung pinanood namin recently? Sweet Tooth, I think. Have you heard of that Sweet Tooth in Netflix? About hybrids, kids with half animal, half human. Anyway, so it turned out ano pala siya, plus 10 years, no? Tapos pinanood ko yung 4-year-old ko. Pero buti na lang I was there. So again, you have to review it and you have to watch it together with your child. And then of course, review it first before you give that choice to them.
Okay po. So, there. Let's have the next question from Josephine. How can we lessen online gaming to teens?
Hmm. Again, it's gonna be family to family, value per value, teen to teen. So hindi siya dekahon. How do you have to really have that discussion with your teen. I think at this time of pandemic, there's no like a fixed, quick fix, duration, and strategy. Kasi you're the one who knows best what's your situation, what are the options at home. Okay? Like for others, they have a backyard. For others, they have bikes. But for some homes, they don't have bikes. Okay? So, what can your teen do, no? Kung wala. Or like for example, like one of my patients no with epilepsy. The lola was parang complaining to me, Tora, palagi na lang siya nakalock sa door, no? Nakalock sa door. Palaging nagko-computer. But when I asked the teen separately, he said that he's actually reaching out to his friends online. Okay? Reaching out to his friends online. Kasi nga naman, that's a need. It's part of their growth. No? It's their psychosocial growth to connect with others. And of course, internet was also a way to connect to others, just like we're connecting right now. So really, you need to see what they're looking at.
Okay, so next question from Miss Jasmine. Our students have been proposing to have an in-trams online gaming tournament, given the absence of sports activities during the online classes. Most of the games proposed, examples, Mobile Legends, Valorant, include violence, but they have mentioned that the focus is more on teamwork and strategizing. What do you think about such games? Given that an event like this may also expose students who do not play into online gaming.
Shak, that's a difficult question to answer, ma'am. Because again, we didn't have these options before, di ba? Didn't have these options before. Um, I guess really we need to face our enemy. We need to face our enemies. If hindi natin gagawin yan, it doesn't mean they won't play. If you won't organize that, it doesn't mean the others won't be exposed to it later. If you're not gonna make it parang as like official school, for example. Okay? So it has to be weighed with your values, options. If you can give an option to e-entrams and to other games that is acceptable to your school values, then maybe that's something that you can discuss with them. Okay.
All right, thank you, ma'am. So from Pretty Ruelan, what about a child who speaks English without being taught nor communicated with the language? His parents attributed this to his use of gadget most of the time. He talks to himself as if he has his own world. Is this a sign of ADHD?
Thank you for your question, Fritzy. Again, this is really something that you need to discuss with your pediatrician because any language concerns can be a manifestation not only of ADHD but also of autism spectrum disorder, of even other learning disabilities. Okay, so it has to be a personalized evaluation. Um, that being said, this we cannot overemphasize no the importance of really human interaction rather than just one way communication through the gadget. Okay. Um, yeah. So if you see that the student who's like that, then that's a red flag. You really need to tell the parent that he or she needs to be seen by a pediatrician, developmental pediatrician, for example. Okay.
Okay, thank you, Doc. So from Cyril Goto, is reading ebooks good for preschoolers?
It's not a straight no. I would say pwede pag wala kang hard print book. Wala kang hard copy na book. Okay, for example, di ba? Di naman tayo makakapunta ng National Bookstore agad, or not all can afford, you know, print books because these are also expensive. Okay? You can. During the early part of the pandemic, di ba, may mga nagpapasa-pasa ng mga ano sa Viber, di ba? Link to free ebooks, link to learning something, free learning. I use that too. But you have to read it to your child. You have to be there. Read it to him. Animate it for her. Okay? Make silly
Yeah.
sounds. Okay? Then, that is as good and even better than a printed book.
Okay. So we are learning that the presence of the parents are really
Yeah.
essential in this discussion of internet and
May,
gaming addiction.
may I add to that, Ma'am Tin? I don't also
Sure
want
po.
to parang make parents guilty, no? Because not all
Mhm.
parents can be physically there, 'di ba?
Yeah.
So I want to be also to be clear then that other parts, other members of your home, whether they're family members, they're your yaya, they're your lola lolo, no, um, forming a good attachment with your child is already as best as a parent's attachment. Okay, if you're overseas, for example, okay, the keyword there is an attachment, a good attachment with the child. Okay, uh, because of course there are really instances that you can't be there physically. Okay, you can't be there physically. You just have to relate to these members in your household, your ideals, your values you want to inculcate. Okay, para you will be consistent. Okay, just like when you say, this is my rule for healthy digital use, it has to be communicated to everybody who takes care of your child. Okay, so that the child will be able to see the structure and to be able to appreciate the consistency in what you say. Okay.
Okay, ma'am. Thank you. So from Sir Sunny Villanueva, so is it recommendable for children who have special needs and attention to engage in online gaming as a way of therapy?
uh y- yes, in a way, Sir Sonny. There are actually studies really looking into specific tailored online game or therapy. It should be advised by your medical team or your rehabilitative team. Okay. It's not just any kind of therapy because we also want it to be stimulating your child in the right way, stimulating the child in the right way, and in an effective way as well. Yes, there is. There's a lot of studies already looking into that. And even functional studies in the brain have shown that they are also effective. No? Kaya parang there's really two sides of a coin in terms of online gaming. It's just a matter of the quality of the game, the quality of the content.
Okay po. So, second to the last question, any recommendation po if nagsi-seizure ang bata?
Thank you for that, Miss Christine. There are online resource. Safe Side. Safe Side. You can Google that. No, Epilepsy Foundation. Safe Side. Maybe I can put it here in a while. So, if the seizure happens at home, of course, then you really have to do the first aid first at home. And the first aid is better demonstrated in that video. And well, particularly then if you're an educator and you see a child, no, let's say seizing, yeah, in your school, then that would be a good resource as well. That video. Now, I'm just gonna maybe copy the link later in the chat box, and you can actually share it with your uh, colleagues.
Okay po. So, that would be helpful. We'll wait for the link to that. So, for our last question from Miss Mirna, are there medical interventions for IGA?
Thanks for that question, Miss Mirna. I didn't dive into the interventions as these are already very technical, and as well as wala pang robust or strong recommendations in terms of pill. When you say medical in terms of pill, wala pang ganon. The main strategy would be first looking at the cognitive behavioral dynamics at home, and of course if that can't be remedied, or that can't address the problem, then we escalate to the therapists or the clinical psychologists as well.
All right. We really thank you, Doc Ludi, for your discussion this morning and for answering the questions of our participants. May we now ask for your final words and reminders to our attendees?
Okay, so again, thank you for this opportunity. We actually love to reach out to everybody. As you know, as a pediatric neurologist, we want to prevent a condition from happening, and that is the most effective way of dealing a condition, preventative. Okay, um, and as educators and as parents, you are the actual frontliners, and you are the most effective interventionalist, most effective therapist for your child. Okay, and with that, we work hand in hand with you in preventing and managing these conditions. So thank you for the opportunity.
Thank you as well, Doc Ludi. And we thank everyone for sharing your Saturday morning with us. At this point, please look out for our next Chalk Talk online sessions. So for the next Saturdays, we will be having digital burnout, digital anxiety and depression on June 26. July 3, we shall have red flags, intellectual disability. And on July 10, autism versus ADHD, must know for parents and educators. Uh, Please do visit our Facebook page for more updates. Just look for Don Bosco Press Inc. And of course, you may contact your Salesiana Books account executives to ensure your slots. For the other reminders, those who have registered for today's Chalk Talk Online, please make sure to attend all 4 sessions of the series to receive your certificate. The certificates will be distributed at the end of the series. So you'll be receiving each certificate of the session at on July 10. Then for the succeeding episodes of the Growing Brain Project series, expect to receive your invites through your emails, and you have to register again to receive your exclusive link to the webinar. For those who haven't downloaded their handouts yet, please check the handout section, then download the handout for today's session. And those who have registered will also be receiving a recording of today's session. Lastly, please accomplish the evaluation survey at the end of this session to help us serve you better. So again, thank you for joining us today at Salesiana Books Chalk Talk Online. We hope to see you again in our upcoming sessions. This is Tina de Guzman thanking you, and until next time.
Quality education through quality textbooks.